Hello, thank you for allowing me to share some of the work of my charity, Operation Hope. I started working overseas with refugees in 2016. Earlier, I had been volunteering in Brisbane with some of the refugees who were arriving into our community who were from Iran. We developed special friendships with these people who have undergone tragedy, persecution and trauma in their home country. In 2016, I heard that a nurse in Brisbane was planning to volunteer in the camps in Greece, and so I jumped at the opportunity to join her. I invited a few friends. Some were nurses, including our eldest son. Others were humanitarian volunteers like me. And so began my volunteering in refugee camps overseas. By 2018, our little group were registered as an Australian charity and public benevolent institution. Our registration is only due to the incredible amount of work that my husband Kim put into making sure we met all the requirements and made all the correct submissions. We also gained tax exemption eligibility thanks to Kim's work. Our ongoing work is supporting refugees and internally displaced people in northern Iraq. So my first overseas journey was to several refugee camps in Greece. Our team of 7 Australians spent 4 weeks volunteering in refugee camps near Athens, Thessaloniki and Mount Petra as humanitarian and medical volunteers. The nurses in our team provided medical support in the small medical clinics in the camps. That included everything from assisting in births, managing skin infections and infectious diseases, to distributing medication for skin infections, fevers and throat infections, plus mental health. As humanitarian volunteers, we drove patients in our hired minibus to medical, dental and eye appointments in the nearby town. We also taught in the schools at the camp and provided extracurricular activities. We had hastily raised $7,000 before we left Australia, which was used to supply essential items to the refugee families. We bought undies, shoes, shampoo and soap, washing powder and rice colanders in a local large supermarket chain. The biggest gift we could give these refugees was to sit and to listen to their stories. Stories of the long, hard journey from their war-torn countries. Stories of the family members that had been killed in the wars. We saw many refugees carrying injuries sustained prior to their long journey to Greece. We had every intention of returning to Greece in 2017, but we ended up following Adventist help from refugee camps in Greece to refugee camps in Kurdistan in northern Iraq. We raised $22,000 for the construction of a ward for children and a ward for women in a new emergency field hospital the non-government organisation Adventist Help had built. There was a cluster of 5 camps in this region, housing 150,000 displaced people. Our small group of 5 from Australia spent 4 weeks in Kurdistan supporting this medical clinic in the Hassan Sham U2 camp 20 kilometres east of Mosul. Mosul at this time was under siege by ISIS, or Daesh as the locals call this terrorist group. The top photo shows part of the primary health care complex that was located next to the emergency field hospital. The middle photo in the bottom shows our son Michael in the emergency field hospital assisting in the care of this malnourished child. When we returned to Australia, we raised a further $6,000 to fund a facility for mental health and counselling for refugees. This unit was located in the primary health care centre next to the emergency field hospital. In late 2017, we also raised over $17,000 to fund 25 operations and treatments for refugee women and children. The operations included a mastectomy for a widow with 5 children, removal of gallbladder or kidney stones due to lack of drinking water, removal of shrapnel, surgeries to repair shattered limbs, eye surgery which included importing a cornea from the US to save the sight in one of the eyes of a 15-year-old girl who was blind in the other eye. She's the one shown on the left-hand side of the screen. We paid for injections for a young boy with haemophilia and burns on a young 12-year-old girl who was then flown to Italy for further operations, plastic surgery, physiotherapy and occupational therapy. She's pictured on the right-hand side at the bottom of this slide. Unfortunately, we had to stop this project because it was very difficult to have a steady stream of ongoing funds to support any further operations. I do have a dream and a hope that in the future, when we travel to Kurdistan with a group of medical professionals, that we can offer surgical procedures as well as the planned training and workshops for the medical professionals in Kurdistan. I returned to Kurdistan in September 2018 with a small team. This time we volunteered in a refugee camp in western Kurdistan, 20 kilometres from the border with Syria. This refugee camp was split into two by a major road we dubbed the Road of Death. It was a major road for the oil tankers travelling from the nearby oil fields into Syria. Many accidents still occur on a daily basis due to the terrible conditions on this road. This camp is divided into two with 5,000 refugees each side of the Road to Death. In the top photo you can see a landscape from inside the camp with students in their school uniforms on their way to one of the schools. These camps have been established for 6 years since the genocide of the Yazidi people by ISIS. There is no shade in this region and life is difficult in the tents where it snows and floods in winter and they experience temperatures in the 50s in the long summer. Electricity is spasmodic and water has to be delivered into the tanks dotted around the camp. Our small team taught English, ran women's health workshops and distributed women's health kits. One of our volunteers used his carpentry skills to do a much needed makeover of the dilapidated medical clinic in that camp. During our visits to Kurdistan, we realised that the hospitals have been under immense pressure and demand because of the influx of refugees and internally displaced people fleeing into Kurdistan. And so our next project was born, where we commenced sourcing donated medical equipment and humanitarian aid, shipping it into Kurdistan. During 2018, Kim and I sourced and packed our first 40-foot shipping container, along with the help from a small group of enthusiastic volunteers. It arrived safely in Kurdistan by January 2019. The 40-foot shipping container was filled to capacity with medical and hospital equipment and humanitarian aid. The top photo shows the whole load sitting in the customs warehouse in Kurdistan. The middle photo on the bottom shows one of the humidicribs we sent. 6 humidicribs were donated by Dr. Paul Craven from John Hunter Hospital, and they've been put to good use in a maternity hospital in Duhok that has approximately 30,000 births each year. In October 2019, I had a phone call from Toronto Private Hospital offering me 2 anaesthetic machines valued at approximately $115,000 each. And so began our second 40-foot shipping container project. We ended up collecting equipment worth an estimated $1.7 million, 5 anaesthetic machines, an infant intensive care unit, 2 huge microscopes for use in theatre, 2 beds for use in theatre, a portable infant humidicrib, an ECG, 5 defibrillators, patient monitors, 56 infusion pumps and a blood refrigerator, 8 new otoscopes from the Rotary Donation in Kind warehouse in Sydney, single-use resuscitators, wheelchairs and mobility equipment, hospital beds and an infant crib. In February 2020, Kim and I spent a night out at Dubbo with a Dubbo Rotarian. The following day, he and his Rotary Club and a group of young male students from an Indigenous school packed our hire truck with a massive amount of equipment from the Dubbo Private Hospital, as well as Days for Girls kits from local communities. In addition to assisting us, PAC, all 4 Rotary clubs in Dubbo donated $1,200 to cover the cost of the truck hire and fuel. We then collected a further 2,913 women's health kits from Days for Girls teams in New South Wales and Queensland. We have now shipped over 5,000 kits for women's health workshops in the camps. This enables the women and girls to gain independence, dignity and freedom. All the women's health kits have been donated to a non-government organisation in Kurdistan called the Lotus Flower. The Lotus Flower run women's centres in 3 refugee camps in Kurdistan. Just one of these 3 camps houses 45,000 refugees. Refugee women, many recently released from ISIS, have been trained to run the women's health workshops and to distribute the kits. This activity and job ensure they are a little more self-sufficient and able to provide for their children, as most of these women are widows. The refugee women who present the workshops are paid a small salary which assists them as widows to support their children. We collected specific medical equipment that was donated to a Yazidi doctor friend. This equipment has only just been successfully delivered across the border into Iraq for use in the small hospital in Sinjar. Sinjar is a city where ISIS committed genocide of the Yazidi people in 2014. This medical equipment includes an oxygen concentrator, an oxygen filling station, an oxygen cylinder and a second-hand defibrillator, plus a paediatric ventilator. This is all life-saving equipment for these traumatised people. The last shipping container sailed on the 3rd of August 2020, arriving into Duhok on the 27th of September. Staff at the Government Directorate of Health in the Duhok province received and unpacked the shipping container. The staff have begun distribution of the medical equipment throughout their 11 hospitals in the Duhok province. The Duhok province houses over 300,000 Syrian refugees and displaced people who require medical services, as well as the local Kurdish residents. Our most recent project was the 2020 Winter Christmas Appeal, where we raised $6,500, which enabled the non-government organisation called the Lotus Flower in Kurdistan to buy enough jackets, socks and boots to clothe 1,080 refugee children. Each child was individually fitted and have now faced the bitter winter with appropriate clothes. Thank you for your interest in the work of Operation Hope. We're just about to launch a new appeal to assist funding a new Garden of Hope in the Sharia camp. This will be a place where there will be a sustainable, organic garden and a place of healing and natural beauty, which will nourish the bodies, minds and emotions of the 210 children, youth and women rescuees and 200 internally displaced persons. Please contact me if you would like further information about Operation Hope, or if you're interested in volunteering or financially supporting our work. We are so grateful that our supporters have caught the vision and goal of our work. Every individual can make a significant impact on the life of a refugee, and that is evident through our work. Thank you.